Good day. I'd like to introduce myself in this short program. My name is Dr. Jim Hilgers, and as you can readily see, I'm coming to you from outer space. I have been in the clinical practice of orthodontics for over 45 years in Mission Viejo, California. And I also presently serve as an associate professor of orthodontics at Loma Linda University. I've written over 100 articles for scientific and clinical journals, and I've also served as an associate editor for the Journal of Clinical Orthodontics. This presentation is about the use of the mini mold system produced by Reliance Orthodontic Products. Now, I know you don't know what that means quite yet. Probably sounds like something you'd find in the back of your bathroom shower stall. But I'm here to explain. During this short lecture, I will demonstrate the use of the mini molds for a variety of simple, pragmatic, and everyday uses. So, without any further ado, let's get this party started. Okay, what are mini molds? Essentially, they are small, elastomeric, soft silicone receptacles that allow the clinician to create precisely formed composite buttons or shapes on the teeth for different functions. Each mold represents a specific design and consists of the mold receptacle and an attachment plug that fits into a carrying wand for easy application on the teeth. The mini molds are packaged by Reliance in a 10-slot kit box for easy access. Also included are 2 blue placement wands. The snap lock and label doors are designed for easy opening and retrieval of the mini molds. The blue placement wands have 2 openings. The contra-angle end is meant for placement of lingual and posterior buccal molds. The straight end is useful for placement of labial molds, where you have a straight-on access to the teeth. After single-dose etching of the target area on the teeth, Reliance's LCR, light cure resin, is a good choice for the composite. It has good consistency and color to create clean, no-flash molds on the teeth. This will later assist in their easy removal. Once the desired mold shape is selected, it's inserted into the end of the wand, either the contra-angle or straight. The cylindrically shaped nubbin or plug on the mold itself fits very snugly into the wand. This allows for an easy yet secure alignment of the mold in its correct orientation. That becomes important for certain linear molds. The mini mold is filled with composite using a CR syringe. The composite should be tapped down to assure the mold is completely filled. Care should be taken to avoid excess composite because the mold will adapt to the curvature of the teeth and we want to avoid any excess flash. The mold is then gently placed up against the surface of the target tooth and light cured in place. The result is a clean, tooth-colored composite attachment to the teeth that has multiple uses, as we will soon see. One of the most common uses is as a retention button for Essex or clear retainers. Different sizes of composite buttons can be used, determined by the need for security of fit of the aligner to the teeth. When using an office-made aligner to move teeth, for example, several buttons may be placed to prevent the aligner from lifting. The buttons are placed, an impression is taken, models poured, and aligners fabricated. I have found the retention buttons are particularly useful when using a mini tane or a partial Essex on certain segments of the teeth. Better yet, when buttons need to be placed on the outside of an aligner to facilitate elastic wear, Reliance Bond Aligner Composite can be used. Although probably not necessary, I've always micro-etched the surface of the aligner, painted on some Assure Bond Enhancer, and then added my buttons. The Bond Aligner can be used with metal buttons, as seen here, but I prefer the composite buttons for aesthetics. Using tads or mini screws, it's possible to intrude or move entire segments of teeth using this stabilizing technique. There are small and large wire bonding buttons that can be used for two purposes. First, they can be used as retention buttons for Essex retainers. The smaller button is especially good in that regard. Secondly, they can be used to bond a lingual retainer or night tie wire directly to the teeth. I've even used the larger button to bond a light night tie wire directly to the teeth to realign them. By using dental floss and positioning the night tie correctly on the teeth, this can be accomplished quite nicely, either on the labial or lingual sides of the teeth. A habit reminder that is a small conical attachment can be used on the lingual of either the upper and lower teeth, depending upon the interferences and tongue position. I am particularly fond of the bite turbos that are bonded to the lingual of the upper central and lateral incisors. One or more of these turbos can be used to facilitate bite opening and allow access to the lower arch for bonding. These also come in two sizes, and I have used the smaller molds where more than one are being placed, and the larger molds when just one or two are being used. The beauty of these composite turbos is that they can be removed easily, like a lingual bracket, with very little composite cleanup needed. A second form of bite turbo that can be used is on the occlusal of either the upper or lower molars. This can be used with colored composite and avoids the composite removal time that is necessary when the entire occlusal surface is covered, especially in the grooves and fossa. There is also a mini mold that serves as a molar tube. I will sometimes use these to cover a terminal wire attached to a second molar and have found lots of uses of this tube in early treatment mechanics. And lastly, and probably the mini mold that I use the most frequently, is the elastomeric button. It can be used on teeth or on an Essex retainer. And as you can see, there is an exquisite detail in the shape of the button to help collect and hold elastics. They are quite useful on partially erupted teeth or for stabilization along with mini screws. Welcome to Reliance's new composite and chain kit. After properly locating and exposing the target impacted teeth, you're ready to apply the CNC chain. Prepare the teeth properly by etching and sealing them, making sure that the area is dry and fluid free. First, open the sterile plastic capsule and remove the polyvinyl form with the embedded gold chain. Insert it into the head of the plastic wand. With the tweezers, make sure that one or two links of the gold chain are positioned at the bottom of the form. Slightly underload the well using the included flowable composite. Place the CNC form gently up against the exposed teeth and cure from the side for at least 10 seconds. Pull the cup away and slide it down the length of the chain. In this intraoral view, we are showing the same procedure. Cure the composite and draw the form away from the tooth by sliding it down the length of the chain. The chain is then tugged to make sure that there is a secure bond, and the surgical site can then be closed. Please enjoy this exciting new innovation from Reliance Orthodontics. I think you'll find the mini molds have all sorts of uses if you're a little clever or creative, and there are lots of new mold ideas coming down the pike. They are certainly fun, really cost effective, aesthetic, and easy to use.